Welcome to today's RD. It's about a different topic today. It's about sleep hygiene and if it's like a sufficient therapy for sleep maintenance insomnia. This RD is hosted by me with the help of the whole community that makes this possible. There has been a study that I want to present from the Washington University in St. Louis. And I just want to point out some key points on the study procedure. What they did is compare the effectiveness of 3 different methods for the sleep maintenance insomnia, which is meditation, stimulus control, and sleep hygiene. The meditation and stimulus control group had also information about sleep hygiene as well. But the sleep hygiene group only had the information for the hygiene and nothing more. The study has been done with 65 adults as a 4-week treatment program. And what has been measured is the wake time after the sleep onset, which I call WASO. Then also the number of arousals and the duration of arousals. And measurements have been taken baseline, pre-test, then at week 3 and 4, and 6 weeks after the program. And they measured it by daily sleep diaries, which the patients filled out every day and recorded or sent to the people every day. And I want to continue with what sleep hygiene is. It's about information on sleep scheduling, what activities you do before you sleep and how you prepare sleep, that you avoid caffeine or alcohol, and sleep comfortable with maybe relaxation before bedtime. Sleep maintenance insomnia is defined as subjective estimate WASO, wake time after sleep onset of at least 30 minutes per night for at least 2 nights per week. And in this group, the mean baseline was 82 minutes that the people were not able to sleep at night. These 3 different groups had a different plan, and it was always there were professionals that taught the people what they have to do. And the stimulus control group, they were taught that they have to regard bed and bedroom with sleeping and nothing else. Some people do, or read a book in the bedroom, or watch TV, or eat something. And these things have not been recommended for the people that took place in this group. Then the meditation group, they had a standardized meditation during the day and also when they wake up at night that they should do. And then there was the sleep hygiene group where the people have been presented several rules. These rules were that you should not drink alcohol within 4 hours of bedtime, no caffeine after 4 p.m., no rigorous exercise within 2 hours of bedtime, and no napping during the day. That you don't engage in, or that you engage in relaxing behaviors before going to bed, and that you don't go to bed hungry or thirsty, and that you sleep in a comfortable environment with not too high temperature, not that much noise, and that you choose a comfortable mattress that's good for your back. And also questions regarding sleep and dreams have been answered, so there has been sleep education as well. Now I want to tell you a bit about what they found out during these 4 weeks. At first they want to see if there was a difference in the treatment compliance, which has been measured by the number of days the people followed the rules. And it showed that the hygiene and the meditation group were more compliant than the stimulus control. When you compare the two, it's a difference of a day, maybe. And next I want to show you like the changes. Here you can see like the changes that happen from baseline to follow-up. And at first, like the changes of the wake time, for all 3 groups, they started with like about 80 minutes and went to 50 minutes, and the meditation group 38 minutes after the program. For the number of awakenings, the number also decreased from 1.8, 1.5 to 1.4. And the duration of awakenings reduced also by maybe half. Not even half, but a bit. And they also found out how much percentage of decrease has been happening regardless in which group you were. Like at the 4 weeks, they said, okay, there's like 31 decrease of the wake time, 20% of the number of arousals, and 21% for the duration of the arousals. And then for the follow-up, the percentage for the wake time even, like the percentage increased, but they had like a decreased time. Then 13% decrease of number of arousals and 32% decrease of duration of arousal. So you can say that there has been a significant effect for time, but they didn't find a significant effect for the group. And I showed you the data for the follow-up, but there has been also these effects for week 3, and they could be maintained in the later measurements. The people were also asked in the post-treatment questionnaire if they would recommend the therapy they did and if they would want to repeat it. And it showed that there's a difference between these groups. The hygiene group was the least likely group to recommend or repeat this whole thing. And it seemed like they had more doubts regarding the efficacy, and also for the therapist, this group seemed more difficult to conduct. I will talk later about possible reasons why this has been the case. And what I found interesting too is that like these groups like split it between people who had the feeling that they have been cured and people who had this feeling not, and that not a lot changed. And for the stimulus and the meditation group, half of the people said, okay, I don't have insomnia anymore. And the sleep hygiene group, there was only like 20% who said, okay, I have less insomnia now. These groups had no initial difference, but you can see it in the numbers also that the cured group, or the people who felt they've been cured had a lower wake time of the sleep onset and fewer numbers of awakenings at the follow-up. And it was like nearly half of the time for the cured people. They also measured if there has been a difference in compliance of the people who had these differences, but there has not been found any differences in compliance. And now I want to discuss this thing a bit. So you can see that there has been an improvement for the therapy that could be maintained for all the 3 groups. And the author said that this is comparable to other studies from like how much things changed. And for the group who only had the information, there has been a decrease in the insomnia, but they weren't really satisfied with how the treatment was, and they believed less that they improved. And 80% would still consider themselves as insomniacs based on like the definition of it. And maybe some reasons are that like when you only have this group with the hygiene rules, that it looks less like a treatment. Like you can really do something and learn new strategies. This has been more for the other two groups. And what cannot be forgot is that like a lot of people who are insomniacs know about a good sleep hygiene already. So when you already have a good hygiene, they learned not a lot of new things, and they had the feeling they learned nothing new. The differences between the cured and not cured groups were like the time of the wake time. It was like nearly twice as much for the not cured, and the number of awakenings. You have to say that like after these treatment programs, there were still a lot of patients who had trouble sleeping. The average awake time at the follow-up was still 47 minutes per night. And also the data based from the people, there needs to be a limitation because it's self-reported. The author said in the beginning that people tend to overestimate the wakefulness and underestimate the total sleep time, but they said that it's like a consistent over or underestimation, so it would be okay. But I think it should still be something that needs to be regarded. And now I would like to continue with what it has to do with poly.
Alright, so thank you for covering the first part. You did a pretty good job. So I added some of the stuff about polyphasic sleeping to the discussion, so I'll take it from here. So along with a lot of sleep logs and what people had to say about what happens during the adaptation, we have seen a very common trend that WASO is actually something that is very relevant, and the huge majority of people report to encounter WASO at least once during any kind of adaptation, and they woke up a lot during either the nap or the core sleep. So what it's defined as WASO in polyphasic sleeping also is the same as these research papers. So after the sleeper falls asleep, they can enter the wakeful state even though they are still sleeping. And as a result, they are very susceptible to being woken up by a lot of stimuli outside, for example, noises, or sometimes they even happen to wake on their own and still go to bed again after that until the alarm goes off. So that is also something to note. The dark period is also a method that has been used by a lot of people during adaptation, and it seems to give some positive effects on their sleep quality, as they remark that they sleep much deeply than usual, and that is also a very good sign of sleep hygiene practice. However, the problem still continued because they still said that they would wake up maybe even more than once during a short nap of only 20 minutes or 30 minutes, or even the core sleep more than once, and it usually takes them a little bit of time to go back to sleep, but for some people that's not really a problem. They go back to sleep almost immediately. But the problem with WASO and how it is calculated is that even if you assume that you would go back to bed immediately, it will still take some time for you to go from stage 1 asleep to stage 2, which is the time that you actually fall asleep. So the numbers that we see so far in this research, such as 30 minutes, 35 minutes, indicates that it usually is the transfer between the wakeful state and NREM 1 into NREM 2 and deeper sleep stages. So that's why they get that number, just to be clear about the sleep stages. And another thing that we see is that no matter what kind of polyphasic schedule that the people are doing, including the schedules that reduce the total time spent in bed, or those that don't reduce their sleep time at all, we all see this common pattern, and also has occurred at least once during any kind of adaptation or transition. And as a result, for some people that are severely affected by WASO and cannot go back to bed, they as a result were forced to wake up and stay awake until the next sleep on their schedule. And as a result, this causes undersleep, which means that they sleep under the amount that is offered on their designed sleep schedule. And that is also a very dangerous problem because it can cause oversleeping later on and possibly even crashes, especially if these people are in the end of stage 2 or starting stage 3 of adaptation. So there are a lot of concerns about whether WASO can be prevented entirely, and we have seen the positive effects of sleep hygiene on these sleepers themselves. So that is a good thing to start with. As a callback from the article's discussion and results analysis, we've seen that stimulus control and meditation look like the real treatment. It is a quote that is directly taken from the article itself. You can search for this in the article later on if you're interested in seeing where it actually is. So this makes me really curious because if stimulus control and meditation look like real treatment, then how real it is and how effective these methods are. So as we see in the different polyphasic schedules, we reduce this core sleep and keep it no longer than 3 cycles, which is equivalent to 4.5 hours of uninterrupted sleep. And this belongs to schedules such as Everyman 2 or Everyman 3 extended, and something around that range. So that would mean that the sleepers get a chance to consolidate their core sleeps even further down, and because there's only 4.5 hours, it actually decreases the chance that they would wake up. And this has been reflected by the people who have adapted to these schedules. Sometimes WASO still happen, but very rarely, and most of the time they just step through the whole course without any problems at all, or not even any kind of small hiccups that cause them to wake up in between. So that is something that is very interesting. That is about the core sleep itself, but about the nap, it is something that is even more complicated and more of a headache to resolve, because we would say that even 20-minute naps is basically impossible to wake up from, right? Because it's way too short. You just fall asleep and you just wake up when the alarm goes off. That's actually not the case. Most commonly for people who are in stage 2 or maybe stage 3, especially when sleep repartitioning and architecture is being adjusted, it seems to show a pattern that they seem to wake up even more than twice or 3 times during the nap, and being able to go back to sleep until the alarm goes off, and they even recall the dreams as well. So that probably explains that it is the presence of REM sleep, and since sleep is not stabilized yet at this point, it means that it is easy for them to alter between the wakeful state and the actual sleep state itself. It's very hard to explain it, and it's also very iffy to look into as well, because we don't really have a clear-cut mechanism that explains why it happens, aside from the potential repartitioning as a factor, but that can't be concluded so far. And another resources that I would want to point to is the book Why We Nap by Corleo Stampy, which is also some very important resource that has a lot of experiments with other sleep schedules with very short core sleeps of about 1 or 2 hours at most, and schedules that contain only naps, which are equivalent to the nap-only schedules that we have today. Unfortunately, during these experiments, such occurrences with WASO were not included at any point during the reports. So what I can only assume is that it doesn't really happen, and WASO is not a thing for polyphasic schedules with shorter core sleeps, because statistically, the shorter your sleep is, the harder it is for WASO to occur. Assuming that your sleep is stabilized and you go through the adaptation phase to get to that point. But again, that is also a very relative parameter to be able to measure directly. But it's safe to say that you just need to get through the adaptation phase, and then after that you should have very little or no trouble waking up in the middle of your sleeps. And as long as you do practice sleep hygiene as shown positive results in the article itself, then it should be a fine thing to deal with WASO, because it's very annoying, to be honest. And the last point that I think is interesting to include is the practice of yoga. So in reference section, I already linked the article to yoga itself, and the results are actually pretty amazing. Is that it actually decreases WASO even further, maybe around 15 to 25 minutes, which is actually very low, and even lower results than in this article itself. The article itself is about like 35 minutes of WASO. So basically 30 to 35 minutes to transition from the wakeful state into deeper sleep stages. But yoga lowers it down to around 20 something minutes. So I have to say that it's actually something pretty good to incorporate into your daily life. If it doesn't really take too much time from you, and you are actually able to make it work. So I have to say that yoga is a pretty good solution in and of itself, and it should actually be practiced. And yoga is good for sleep for a reason. There also has been a lot of other internet articles and blogs online saying about how good yoga is, especially for sleep, and people fall asleep more easily, and they don't really have trouble with their own sleep. So it is something that maybe can be used in tandem with polyphasic sleeping to make sure that WASO is handled and eliminated entirely in the long run. It's a very annoying problem, but it can be taken care of. And aside from the reference section, so I guess the discussion is over for both the article and any other relevant resources. So if there is no other question, then we'll be fine with that. And thanks to everyone who actually make it to the discussion today to see this topic, because it's actually something that is very, very relevant, and people only notice it when it actually happens. And hopefully we can find more comprehensive measures for this thing in the future.
Okay. I'm wondering, were there no one in this study who tried multiple methods to see how their wake after sleep onset was? Were there only 3 groups that each tried one method, no multiple methods groups?
So did I understand your question right? That why there are only groups who do one method?
Yeah, more are there only groups who do one method?
Yeah. It has been strictly split into these 3 groups by coincidence, and they only did one thing. But I don't think you have the sleep hygiene rules also in meditation and stimulus control. So it's not really true that you only have the meditation and only the stimulus control. You also have the sleep hygiene part in it. But the people only did one of the 3 things.
Okay, I get what you're saying, and I think that your point about the reason why the sleep or the sleep hygiene group, why they performed the worst, or why they felt like they didn't get affected by the method as much as the others, I think that your conclusion there is quite on point. My experience has been that people who suffer from insomnia know about sleep hygiene methods, and if you've already probably tried all of them, then you're more likely to see that or feel like they aren't as good, even though your results might say different things.
I think maybe you can have better results when you give the people the feeling that they do something, when you do it maybe as a challenge or a game or something, then they or do certain tests that promote sleep hygiene rules itself, then maybe they would have like a better feeling because they feel like they do something. Maybe that would change the results too with the satisfaction.
Yeah, and also if we like look at the sleep hygiene procedure in of itself, it's quite harsh, you know. Oh, you are only allowed to look at monochromatic light. Oh, you shouldn't drink coffee after this hour, you know. There are quite a few negative things stacked on top of each other, so maybe it's harder to see the positive results if you're blinded by the negativity of the whole procedure.
I think too that maybe, so I don't think it's a surprise that they had like problems with the satisfaction, but I was surprised that like the reduction of the time was the same, like approximately, that it did not like differ that much, because like in the other two groups you had in addition like meditation as stimulus control. So I would have also like expected that the data would be a bit better for the other two, but it wasn't, like not significant.
Yeah, for sure. And General, you said that you didn't really have an explanation for the WASO in naps, but do you have any kind of speculation for it other than like an alteration of sleep architecture? Could it be that once the homeostatic pressure reaches a certain point, you just start waking up? Or is it like the process of entrainment, like when it's gone a certain length, your body starts to become really confused, you know? Do you have any sort of hypothetical mechanism proposed for it other than the sleep architecture alteration?
I don't think so. It's very hard to say based on what we have seen so far, because the sleep architecture may account for the whole thing that happens, because we have seen a lot of EEG graphs that are very messy, and there is also alternation between REM sleep and other lighter sleep stages like NREM 2 or something like that. So I mean, a lot of things can happen around that time, and I think it also may be affected by the dreams that the sleepers are having, because quite a couple times the dreams can actually wake people up, depending on how bad they are, or like if they suddenly just snap out of the sleep themselves. So in the case that it happens before the wake time, and it is also a contributor factor.
I also had like made the experience that dreams can wake me up, but for me it's like not insomnia. I noticed that I wake up, but I fall asleep really fast. So that's not a problem, but I noticed that it's more light sleep then.
Yeah, for sure. And I mean, I've presented a few hypotheses, whatever you say, right now just. And I think that they should be quite easily testable. You know, if it's because of the homeostatic pressure that people start waking up, we could just see how they, you know, perform on nap-only schedules. I mean, you already said that in Claudia Stampy's book they didn't wake up during Uberman, but that book's quite old, so it would be nice to see some new information on that. Or if it's just entrainment, we could see if the same thing happens if like on flexible schedules or random schedules. You know, quite a few possibilities here.
I mean, when you have like when these daily diaries are valid, then you could also like do a survey here on polyphasic.net or something. Because like when they use like daily diaries for the data, then like the subjective opinion should be a valid one.
I think for random schedules it can be explained that because the sleep itself is all over the place, and there is no control over what kind of sleep to go into, what kind of sleep stages to go into each sleep. Then it often happens that people wake up in a state where they feel that they can go back to bed, but they actually can't, and they have to end up getting up in the end because of the sleep inertia, and that is also something very annoying. It sounds like they wake up in the deeper sleep stages, but they can't fall back asleep because the body is confused by different sleep times, and it becomes uncontrollable in the end. And another factor that could contribute to the development of WASO is I think it's a bad sleep habit. I mean, if your sleep is broken for a long time, then it would take a very long time to fix it again, and it can also be impossible to get it fixed, to get it back to where it actually is at the beginning. Something is broken can be fixed, but if it has been on the permanent level of damage, then it's probably not going to be 100% salvageable at that point.
And what I think, like, some people told me that they sleep better or don't wake up at night so often when they don't have any electric device in their room. Maybe it's also like the knowing about things that, like, the conscious mind or the subconscious mind, that makes people like wake up during the night. Like when you have a lot of stress or when you have things on your mind, I can imagine that you wake up more often. So I think that's my meditation works good. And there could also be other like things that you can reduce stress with to promote a less wake up time.
Oh, and I forgot to mention that sometimes people feel that they actually get a good amount of sleep, but they wake up and they feel not fully rested. So based on that explanation, I can speculate that because the sleep has a lot of light sleep rather than the vital sleep stages. So that explains why they don't feel that they get enough sleep at all, and despite the whopping amount that they try to get each day, that still not enough, because the vital sleep stages just for some reasons don't get into their sleep at all, or not all of them. So it could explain that because of there's a lot of light sleep and potentially NREM1, some kind of NREM1 even in their sleep, it makes it easier for them to wake up, and the washout problems become more serious as time goes on, especially if you just basically get a lot of light sleep and you don't really get much of the vital stages, that could be resolved too.
Yeah, that could be. What I thought is like they said that the insomnia is like defined as having at least 2 nights per week with more than 30 minutes per night awake. And like I thought that when you have such a lack of sleep but don't nap, why does it then happen so often that you wake up? I mean, then you should sleep deeper. Like maybe it's too naive, like I think, but I thought like when you have many days where there is the insomnia, then you should have also a lot more days then when you recover from it, and then you don't have that much problems with it. And then it starts again, the cycle.
I mean, it probably takes a serious amount of sleep deprivation to build up to be able to sleep that deep for a couple days, and then, I mean, when things are done, then it just goes back to where it was, which is even a bigger problem to deal with, because now that means that you can only actually get a good amount of rest if you actually sleep deprive yourself, and that is usually not the approach that people should look for, because being sleep deprived long term is known to cause a lot of cardiovascular related diseases and a lot of diseases in the body that is accumulated over time because of sleep debt that has never been resolved throughout the years. So I mean, not getting enough vital sleep stages like REM and slow wave sleep are very detrimental to health for that reason.
I want to point out that what you're talking about here, it's a bit more complicated than what you're presenting. I mean, Sleepygirl, you said that you feel that people should be able to stop having insomnia symptoms if they sleep deprive themselves, and that's true. There's a cognitive behavioral therapy that I call the sleep box. Basically, you sleep in a restricted time only, and because of that, you start having less wakes and start falling asleep more easily until you finally, start falling asleep like a normal person. But that takes quite a bit of time to build up, and the most important thing here is the entrainment of the sleep times. So let's say that you're normal everyday insomniac and you can't fall asleep. The next day you fall asleep earlier, and because of that your body is a bit more confused. The day after that you wake up really early, can't fall back asleep, it's even more confused, and so on. So you need to have the strict sleep times as well. It's like the sleep pressure or sleep deprivation doesn't in of itself fix the problem. It needs to be like combined with following a strict schedule.
Yeah, I think like I was surprised that in the sleep rules they didn't include like having similar sleeping times, because for me that's sleep hygiene too.
Yeah, that's the sleep hygienist of them all.
Yeah, that's why schedules like random that don't really follow it, and if you actually look it up, irregular sleep wake rhythm WASO is directly tied to it because it is classified as one, and because you sleep at irregular hours over time, then over time you will wake at irregular hours as well. That's a byproduct that goes along with what you do to your sleep. Is there anything else that you think can be useful?
I'm good. Are there any questions?
Nope, it's good on my part. Thank you.
Okay,
Okay,
then
that's fine.
thank you, General, for your part, and then have a nice evening, everyone.
Sure. Thank you.
Yep, thank you. Bye bye.